Hi, this is Mr. Mohammad Adil, Fellow of the Royal College of Surgeons of United Kingdom. I'm General Surgeon, specialist in colorectal, breast, and laparoscopic surgery. I have been working for the health services in UK for the last many years and contributed significantly in patient care and advancing medical knowledge, skills, and experience by training post and undergraduates. Last year, I successfully conducted two international scientific conferences in Penny Acute Hospital Trust in UK, where I was working. I also delivered my lectures and contributed in conducting workshops in different medical universities and medical colleges in Pakistan and delivered lectures in King Edward Medical University, Nishtar Medical University, and 7 different medical institutions in Pakistan with great appreciation. And I was awarded as international speaker from UK with large number of shields and certificate as a token for appreciation. During the recent pandemic of the coronavirus, when the world was terribly confused about its management and the outcome, I critically questioned the far-reaching effect of the coronavirus on the public personal and social lives and employment. I had no intention to play down the virus or to politicize it. With a long-standing experience, I felt obliged to contribute my scientific knowledge, research, and experience to help out societies and the scientists to make major impact in terms of relieving the tension, anxiety, stress, and fear generated by the mainstream media. Unfortunately, this was not appreciated by my regulatory body. And a few weeks ago, I received a letter from General Medical Council that I was being investigated for my videos on COVID-19 released at social media as a result of complaint by a couple of members of the public. I was given only 4 days to appear for interim order tribunal hearing. This was extremely short time and I was not able to engage my legal advisor, so I requested twice for adjournment of the date. Unfortunately, this was disregarded by the General Medical Council. However, I cooperated with the regulatory body and appeared in the interim order tribunal hearing, which was carried out over the Skype. During the hearing process, I came to know that there is a hearing bundle involved, 247 pages, which has not been provided to me prior to the hearing process. On my request, they emailed me that hearing bundle consisting of 247 pages, and I found it extremely difficult to go through the bundle to work out my response. I was also given only 90 minutes to return for the hearing process. When I came to the hearing process, I was suspended for a period of 12 months and my license to practice was stripped off by the General Medical Council. This was extremely shocking and disproportionate to my appearance on the social media expressing my point of view over the COVID-19. And I had no complaint, no negligence, and no misconduct related to my workplace, with my patient, or anything related to with my professional capabilities. I requested against the decision for 12 months, which was extremely unfair and disproportionate to my expressing my point of view, which was again disregarded. And I was told that the earliest hearing process would be not before 6 months, which I'm waiting for. I'm terribly disappointed. I feel isolated and I feel that I have been discriminated and targeted. My 30-year experience while working for the NHS, taking care of my patients, advancing medical teaching and training to medical students, post and undergraduates has not been taken into account. I had spotless record with the General Medical Council, which has been not taken into account either. I was not given sufficient time and the opportunity to engage my legal representative to submit my response. So this is extremely disappointing, and I feel myself that this is me today, and it could happen to anybody. That's why my question to the health professional across the world is that if I could have this suspension for 12 months for expressing my viewpoint, then anybody could be picked up in future. It could be you, it could be him, it could be they, or it could be them. So that is a point of consideration, that what is going to happen in future and where we stand. I leave it to you to decide what is the best. I stood for the members of the public to relieve their anxiety, stress generated as a result of constant misguidance and misinformation by the mainstream media to the public. And I acted as a public voice to express my point of view, which has been highly appreciated by millions of people across the world. And I really have great words for everybody who had very kindly been very supportive. And I do regard for my juniors and my professionals and my colleagues who have been working with me, and they remember that I have contributed a lot for their training, teaching, and advancing their knowledge and skills. And most of them are working as consultants in various parts, not only in UK but also in other parts of the world. So this is where I am, and I leave it to the public and the health professional and the regulatory body to decide about my future. Many thanks. All the best. Bye bye.